All right, so once again, hello everyone. My name is Abiodun Oluokun. I'm the training manager for Supreme Care Services, and you are all welcome to today's training, which is on infection prevention and control, really based on the COVID-19. Okay, so we want to actually, this is like a refresher for many of you, because in the month of May, April/May, when the pandemic started, we actually had a training that was sent out to everyone, and there were some live webinars as well. But as the lockdowns are easing, a lot of people might be thinking that COVID-19 is actually gone, but that's not the case. So we still need to take the precautions and the measures and make sure that we are actually following the guidelines provided to us by the government and NHS, okay? So we're gonna be looking at the things to actually emphasize in our work as care workers and even in the office as well, okay? All right, so today, part of what we are going to cover, which are the learning outcomes. We're going to look at the description of the coronavirus again, you know, the routes of the transmission, how to apply the standard infection control precautions, either you're in domiciliary care setting or you are in, 1 second, or you are in the care homes, working in the community. We would look at standard infection control precautions. We would also explain the transmission based precautions that are necessary for the COVID-19. So as the lockdowns have been eased off, a lot of people are out there in the community, but what that just means is that there are more people likely to be carriers, there are more people who are likely to be infected, and so the precautions still need to be put in place so that we can protect ourselves and also protect our service users and our loved ones as well. And then finally, we would identify the location of key guidance about coronavirus and explain the importance of online access. So where to find updated information on the current pandemic coronavirus. We would look into that as well. Okay, so we are nearing 93 of us on the call. And hopefully, once we are 100, the classroom will definitely close. And those who cannot actually enter, just in case you have colleagues that are actually saying to you that they cannot actually enter the online classroom, there will be a recording made available to them so that they are not disadvantaged. In the course of the training, in the course of the webinar, if you do have a question, which you might have, please feel free to use the chat box at any point in time. Just pop, you know, your question in the chat box as it comes to your mind so that you don't forget. And from time to time, and my colleague Abin would actually check the chat box, and she will be able to give us, read out the questions and let us know, and let me know. So we would take questions periodically. So I'm just checking if Abin is enabled with audio. So you can unmute yourself, Abin. I'm just checking that you are able to speak.
Yes,
hi, Abin.
I'm online. Hello.
Can you say something so I can hear you?
Good morning, everyone.
Okay, so I can't actually hear you. And I'm checking, I would have loved you to be able to read out the questions if there are any at any point in time. Okay, so let me just check my settings and be sure that I've not muted. All right, so now I can hear.
Hello, can you hear me?
Yes, I can hear you now.
Okay, fantastic.
Okay, so you can mute yourself because you are in a busy
Yes, I'm so sorry about that.
environment. And with that, I'm not even sure if you would not need to move location to a quiet place so that if you have to read questions, okay? All right.
Okay, I'm moving now. Thank you.
Okay, great. Thank you very much. All right, sorry about that, guys. We're going to take off now. Okay, so what is the coronavirus? This might be a question that might be dumb because we've been through it for like 3 months now. And by now, I expect everybody to be aware of the coronavirus. But I'm not taking for granted the fact that some of us might not have done a study on the actual coronavirus. You're just aware that there is a killer out there. So I would refresh your memory. Coronavirus has actually been, this virus is like a family of viruses. So none of them have been around for a number of years. The very common one that most people talk about that they're aware of is the MERS and the SARS. But now we have a major one actually during this year, 2019 actually, stroke 2020, which is the COVID-19. And that's what this coronavirus has been named. So you hear coronavirus is the same thing as COVID-19. These are acute respiratory infections. And so that's why most of the time when we are talking about the precautions to take, it has to do with your respiratory system. And it's very, this one is quite wild because it took us by surprise and actually took the whole world. It took up the whole, every country in one way or the other has been affected. But if you look at the history, how it's actually been unfolding. The main outbreak started actually in December 2019. And by January, it was actually identified as COVID-19. By 31st of January 2020, we had the first 2 confirmed cases in the United Kingdom. By February, then we now had cases actually in London. And by March, we definitely, it was now a worldwide pandemic. At the moment now in the United Kingdom, there are the reported cases are getting fewer and fewer as the lockdown has actually been eased. It's due to the fact that we do know that there's a recess in the reported cases. So between 14th of June and 27th of June, from the reports that we got from our Prime Minister, it does say that there have been about 25,000 reported cases, in the United Kingdom, which brings us down to the statistics of about 1 infected person in 2,200 people. It's also noted that the new cases per day are actually shrinking. And so we're getting the percentage of about 2% to 5% of new cases on a daily basis. Also, the cases of people, dying have begun to fall substantially, very that's good news for us. So we do know that there is actually a decrease in the reported cases. However, it's actually important that we know that the transmission of this infection due to the ease on the lockdown is actually on the increase. Not many people will begin to show signs or symptoms. And we do know that the majority of people that might be on the streets, there's no way to actually tell that they have this virus, the coronavirus, and we are still taking public transport, going out in the community, and then going into the homes of our service users. So the more reason why we still need to take this very seriously. We can't let down our guards. We are not, and we are anticipating that there might be, another wave of the pandemic. But actually, we don't want that to happen. But if it does, it shouldn't catch us as care workers off guards, because we should be taking the appropriate precautions. Okay, so these are just the statistics. The way things are going it's expected that there will be changes in the guidelines. So there are a few changes in the guidelines as of this today, which we'll be looking at, and I'm sure that you might be aware of them if you've actually accessed the important sites like the gov.uk sites. You might be aware of them, but it's good for us to actually share these new guidelines with you so that you are not working in ignorance and you know exactly what to do. And today will be a good day to ask questions. If there's any questions that you've been having in mind, this is one of the reasons why we've called for this training. Okay, so how about the transmission? How is this COVID-19, how is the coronavirus being transmitted? We all know it is jumping from human to human. The transmission does occur through mainly through droplets and contact. And that's the reason for making sure that we keep our social distancing. So social distancing is still a rule to be observed. The 2-meter rule is still heavily in place. We should be observing it. But as care workers, we do know that we are working in an environment whereby we might come into contact with our service users, which will be less than 2 meters distancing, because we might be providing personal care and we might be providing other responsibilities that bring us in contact with family in the service user's home and also the service users themselves. So we know it is human to human, and we know that it's basically droplets and contact. We also know that the COVID-19, you can find the infection actually in blood, in feces, in urine, in some cases in tears. It's not actually known to appear in sweat, as of now from the statistics that have been given. But other body fluids, you do need to be conscious of the fact that COVID-19 can be transmitted through body fluids. Okay. All right. So how do you how do you actually identify, somebody that is affected by COVID-19? So we all know that when someone starts coughing, having high temperatures, fever, they begin to have difficulty in breathing, there is a possibility that that person has contracted COVID-19. And then that person does need to actually test and also check and also make sure that they shield themselves from the public. Other signs or symptoms that people might have, those who are infected with the virus, might be fatigue, headaches, muscle aches, sore throats, running nose, nausea, and vomiting. It's important to note that the incubation period is between 4 to 6 days. So if you're actually maybe sneezing or coughing, it might not necessarily be COVID-19, but over a range of days, you'll be able to tell what are the other symptoms that you are experiencing. And if you are experiencing high temperatures, difficulty in breathing, you do need to self-isolate. So we do know that the incubation period is estimated within 4 to 6 days, and it can range within 1 to 14 days as well. That's why when you are asked to self-isolate, you might be self-isolating for 14 days. If within 7 days you do not experience any, symptoms, further, you need to clarify by dialing 111 and getting clearance to be sure that you don't actually have the coronavirus. There are also testings in place going on that you can go and test as well, so that you are pretty sure you don't have it. But it's good to know that there are still people who might be coughing and sneezing and it's actually not COVID-19. We are all aware of that, but you do need to be sensitive to any forms of symptoms. Okay, all right. So let's look at the approach that has been used by our public health. We know that in the last few months, there has been a total lockdown. However, there's now been an ease of the lockdown. So the stay at home actually helped, the self-isolating, many people working from home. But as you know, we are key workers and we've been on the field. With that, I would like to really say a very big thank you to all our care staff. You are superheroes. Many people might be talking about NHS and talking about the nurses. but we are also all superheroes, and your work is being appreciated even by our director of Supreme Care Services, our senior management, all your care coordinators, your managers. We are all proud of you. Every one of you that kept, being faithful to going into your service users' home. You've done so well. And we know that even at the thought of the fact that you're key workers, you could have just quit and said that you didn't want to do it, but you stayed put. And we all survived the first wave. And that's the reason why we are going through this training again, to make sure that we are all conscious of the preventive measures to actually stay safe and stay well. So part of the prevention that was put in place by the government was to stay at home. It's been released now, and there was reduced social distancing. So we were not hugging, we were not shaking hands, and still do that. I do see that a lot of people are, relaxing on the social distancing, but you still need to do that because you don't actually know who is carrying the virus, and you don't want to infect yourself, your family, or either your service users as well. Some of our clients decided to shield, whereby maybe they didn't want care at the time, but many of our service users have come back on board, and they're happy for the carers to come in. So be aware that there will be increase, in the work that we have to do in the community and in Supreme, and we want you to actually be ready to take on, new packages, to take on service users, and most especially to know that some of these service users will definitely have the virus, and there is training involved in how to actually work with these service users. We're not eliminating these service users that have coronavirus. Some care workers might even have it, and you are going into their homes. So you finding out that someone has coronavirus is not a death sentence. But we do need to talk about what are the precautions that you need to put in place as a care worker. So this is the prevention that was put in place, and they've given us guidelines as well to use in our industry, the health and social care. So alongside the stay at home, the social distancing, the shielding, we also have, hand hygiene, respiratory hygiene. So everywhere now, even if you're going on public transport or you're going into social places, you do need to put on your mask. You need to wash your hands very frequently, use your alcohol rub. So all those prevention precautions are still in place. And these should not actually be taken lightly or relaxed on. Okay, so I'm going to flip my slides actually to the current COVID-19 updates that we have. I think the last update was 3rd of July or maybe 24th of June. And so what I have on my screen might not be the latest. So I'm just going to flip my screen to the latest. But before I go on, I'd just like to check the chat if there are any questions. Okay, so I would continue, and if there are any questions, please feel free to type, in the chat box as we agreed. And Abin, you can always stop me at, any point in time to bring these questions to my notice.
No questions as yet.
Okay, thank you very much. Okay, so let's look at the current guidelines that we have, especially for the domiciliary. I'm sure most of us on the call. Is there anyone, if you're on the call and you work in the domiciliary sector, say dom care, right, on the chat box. And if you work in any of our care homes, say care home. I just want to see the statistics of those who are actually on the call today, and also to make sure that you're not dozing off wherever you are. Okay. So if you're in the dom care, say dom care. If you are in the home care, say, or in the care home, I mean, say care home. Okay, so I see a lot of dom care, and I see some care homes. Great. So we're going to make sure that we cover both, even though I'm using the guidelines for domiciliary care, because that's actually the vast number of care workers that are online today. We would look into making sure that we cover both. So currently now, there has been a little bit of updates with regards to the PPE. We all know what that is. So protective, the protective clothing that you use while you're at work are recommended. There is a recommended standard of how you should use them and how you should actually take precaution in the community while working with service users. So let me scroll to the current guide. At the moment now, if you're working with anyone in the community or you're working with anyone in the care home and they are confirmed to have COVID-19, that's not a problem. When providing close personal care, with such kind of clients, or you are within 2 meters of anyone in the household who is coughing, there are recommended PPE that you must use. And I'm sure you might be aware of this, but we just want to make sure that you're aware of the most updated guidelines. So it's important you have your disposable gloves, you have your disposable plastic aprons, you have your fluid repellent surgical mask, and you also have eye protection. Remember, if they're actually confirmed, then you do need all this. So you would find that before we did say that for every client that you go to, you should change your surgical mask, your mask. That's what we said. But from the guidelines, as you can see on my screens today, it does say that you can wear the same mask between different home care visits or visiting different people living in an extra care scheme. If it is safe to do so whilst traveling, you don't need to take it off. The real danger here is if you keep touching your face. Okay, so if you keep touching your face, then that might warrant that you have to change your mask. But if you don't, then you can actually use the same mask in between visits and also for a prolonged shift. So if you're in the care home and you're going from client to client, you can use the same mask. With regards to disposable gloves and aprons, those ones are single use. So every time you deal with a service user, please make sure that you dispose of your gloves and your aprons. For the eye protection as well, which could be visors or goggles, if it is single use, then you need to dispose it immediately. But if it is actually reusable ones, you can actually use it for a longer period of time. So there's a difference in continuous use and actually individual use. So if it's individual use, then it means that for that particular client, you've gone in there, you feel that maybe your mask has been damaged or it's wet, whatever or it's not comfortable, it's become damp or it's broken. For those reasons, you do need to dispose that mask. You shouldn't actually take it to another service user's house. So that is the clear guidance that we have at the moment. So which means if you have maybe just 3 clients in a day, you can actually use the same mask. If it's not damaged, it's not wet, and you can go from client to client. You can travel with it as well. We are all going on public transport with the mask as well, so you should feel free to do that. The point where you actually dispose it is if for any reason you've actually tampered with your face, then you do need to dispose it at that point, okay? All right, there are a few QA that might be helpful. So if your client does not have COVID-19, you have no reason to touch them, you work with them within 2 meters, right? You still need to use the surgical, you need to use the mask, okay? Depending on what kind of responsibility you are carrying out would warrant you using an apron or gloves. But you do have access to this PPE. So if there's any reason for you to touch surfaces, even if you are not in less than 2 meters range with the service user, or you even are in 2 meters range, use your gloves and use your apron so that you can protect your clothing, you can protect your hands, you can protect yourself from touching surfaces, and you have masks as well. Use them, even if they do not have COVID-19. What we would say though is that the eye protection would not be required in this instance. So the goggles and the visors would only be used for those who have been confirmed to have the virus. Okay. All right, so let's look at some of the questions just in case you haven't thought of them yet. Some of the questions that might pop into your mind and has been dealt with under the new guidance. Okay, so why is okay, let me start from the top. So what is meant by, okay, so do I have a question?
Yes.
All right.
You have several questions from Asisat Oni,
Okay.
and she's basically asked if proper PPE would be given out other than the face mask that they have been receiving.
Okay, so as I said, I would really like to know what you mean by proper PPE, because the list we have given, we are providing gloves, we are providing aprons, we are providing you with the mask, we are also providing you with eye protection where you are working with confirmed cases. Also, we are providing the hand gels. So is there something else that you mean by would we be provided with? So those are the standard PPE that you require, and it's available in for pickup in the offices.
What she has stated is that the goggles, she has not been in receipt of any goggles, and yes.
Okay, so if you are working with a confirmed case and you require that, please, it will not be given at random to all staff, but if that is the case and you're working with confirmed cases, please request for disposable goggles. Some of them are single use. I think that's what we have. So you can request for that. So I hope that's clear.
Okay, Patricia Evans has asked, what about sleeve protectors?
Okay, so for so you mean the shoe covers?
Sleeve protectors, sleeve.
So in the guidance, as you can see, we are following the national guidance. It is not recommended that you need to put on sleeve protectors, and I would explain why. As much as possible, PPE is one of the prevention precautions that we use to ensure that we are not infected with the virus. But hand hygiene is also very, very vital. And in the process of washing your hands, you do need to actually wash your arms as well. So you are better off actually wearing short sleeves whenever you are at work. That's why our uniforms are actually short sleeves. They are not for a purpose. And so when you wash your hands, you can actually extend to washing even your arms as well. So the guidelines does not say that you should use sleeves.
Okay, another question from Jessica, and she wants to know if she can get hand gel, as hand gel is finished at the moment, but she's expressing the need for hand gel. Will the company provide hand gel to the care workers?
Yes, we have been providing hand gel. Please speak to your branch. I'm sure that there are quite a number of us on the call from different branches. So if you do run out of hand gel, please speak to your branch. It's part of what we are providing. Okay, any other questions? All right, so I take that as a no. Okay, so before I go to
no more questions, sorry.
All right, that's fine. If you actually, and I just want to say that if you are able to enable your video at this moment, feel free to do so. That would be nice. So we can actually capture some faces. I can just see only myself. It would be nice to see some others as well. So if you are seated, you're not in your pajamas and you are not in, an awkward position where there are children all jumping around, feel free to enable your video. That might help as well. Okay. All right. Okay. So let me switch back to, so we talked about the guidance, and that clarifies what is expected with regards to personal protective equipment. So let's look at, we all know that the vulnerable groups that that are being referred to that are more likely, to be at risk of this severe illness are within the ages of 70 and above, or people with underlying health conditions. This has been expressed in our first training, that even if you as a person also have underlying health conditions, it should be brought to our notice. Bring it to the notice of your manager. But we do know that health questionnaires were filled when you took up the employment, but if there have been changes, these need to be updated on your file. We don't want you to be at risk. So this needs to be made known to your managers. Some of our service users at the time when it was actually very intense, they shielded themselves, but a lot of people are beginning to take on care again. Okay, so we don't want to take the coronavirus into their homes, and hence the reason why we make sure that we actually following all these guidelines. Let's talk about the chain of infection so you understand how this infection actually spreads. And actually, this is how any infection spreads. I always like to say that coronavirus might be deadly, but there are so many infections also that are deadly, that you do need to actually protect yourself from. So understanding how infection actually spreads is very vital to you taking the right precautions as well. So it is noted that infections, they actually are as a result of pathogens. So we're talking about viruses, fungi, bacteria, protozoa. These are the causes of infection, and they actually need to live in a host to survive. So the host will be the human being. So any of these viruses, this virus has to actually live in a human being. For this virus to move from one human to another, then it now needs a transmission model. So if you look at the circle, so on my screen, what we call the chain of infection, the causative agent is the pathogenic organism, which at the moment now is the virus, the COVID-19 virus. They need to actually survive inside a reservoir, which is the human being. They need to be in the bloodstream. If they're going to exit from any human, they find a means out of the body. Now, the means of exit will be through body fluids. So through feces, through urine, through sweat, through tears, through blood. These are the means of exit from the body. Mode of transmission, hands, okay? So we are the ones actually dealing with the body fluids, and we need to make sure that even though it has exited from the body, we are contacting it with protective clothing and not with our bare hands. So we are not actually the means of transmission into our bodies. But you do know that surfaces actually are means of transmission also, even apart from our hands. So when you take off bed sheets, when you remove soiled parts, where do you put them? You need to think about breaking the chain. You have to actually dispose used PPE, dispose body fluids appropriately so that you're not leaving the virus on surfaces. Then the chain continues to the way it enters into another body. So how does it enter into another body? This particular virus, we are saying that because it has to do with the respiratory system, it goes through either from your hands to your face, to your nose, to your eyes, to your ears, and your mouth. So this touching, has to be reduced, highly reduced. Even when you're using PPE, you should make sure you're not touching areas on your face. And that's how the person gets the virus. So as long as this chain is not allowed to complete, then you don't have infected people walking about. You just have to keep breaking the cycle. And how do you break that? Ensure that the virus, even though it gets out through body fluids, it is truncated. It does not get into another person. It does not left on surfaces. Hence the reason for cleaning, a lot of cleaning. So the sneezing, the coughing, these are the ways that the virus is getting out. And that has to actually also be curtailed. Hence the reason for, the catch it, kill it, bin it, right? So you want to cough, we've been told, don't cough into your hands, cough into your shoulders, cough into your folded elbow, right? If you have your handkerchief handy or disposable tissues, which is what you should use, not handkerchiefs, you should use disposable tissues. You cough into it, you sneeze into it, you bin it immediately, and you wash your hands. Okay, so this is about breaking the chain of infection. And if you are conscious of that always, you'll find out that when you finish work, the way to break the chain of infection before you get home is to make sure that you wash your hands regularly. When you get into your home, take off your uniform, put it into the washing machine, let it get washed immediately before you use it again. Okay? All right. So these are standard infection control precautions that you need to take to keep the virus at bay. Make sure you observe the hand hygiene. Make sure you observe your respiratory hygiene, and make sure you use personal protective equipment all the time, as we have said, according to the current guidance. Okay. All right, so your uniforms are important. There is a reason why you shouldn't be using, there's so many reasons why you shouldn't be using your clothes, your personal clothing. So if you have your selected uniforms, your selected bottoms, then you can wash it consistently, hang it in a place where you know that at least it's not with your other clothes as well. The way you deal with laundry as well when working with service users is important. These are things to take precaution with. You can't actually be flipping bed sheets in a client's home or flipping clothes when you're folding them. There's a way to take things off the bed, fold clothes from the washing machine, take the appropriate precautions to actually break the chain of infection. Okay, all right. So let's look at hand hygiene. How do you wash your hands? Very important that you do it the right way. So I noticed that, in a branch like Sodok, when you come into the office, you will be asked to wash your hands. How often do you wash your hands? Can you count the number of times you're washing your hands? How often? It can't be only when you've had your bath and when you get back home. It has to happen every single time you take off PPE or before you put on PPE. When you actually come off the public transport, PPE is not a substitute for proper hand hygiene. The hand gels are just also a backup for when you do not have access to water. And so you do need to make sure that if you have access to water and soap, that is your first go-to, not the hand gels. The hand gels are just backups. When you use, the hand gels, also use them like as if you're actually using water. So what I mean by that is the different 6 steps that you need to go through when washing your hands. Do that also with your hand gels. It's not just to rub on your palms and you're done. So how do you wash your hands? It has been noted that, there are areas in our hands that actually don't get washed. So these areas are areas like in between the fingers, at the back of the palm, at the side. These areas don't always get washed, and also your thumbs. So when you want to wash your hands, follow the standard 6 steps. First of all, wet your hands with water. You wet your hands with water, then you apply the soap, and then you rub. Once you start forming the ladder, then you go in between, and then you go at the back, and you do the second one as well, right? Then you have to actually do your fingertips. So you have to actually rub it all in, and then the back of your hands. Then try and do also the sides because they don't get touched. And then you go for your thumbs, right? And then your wrists, because sometimes that doesn't get done as well. And then you can now rinse your hands. So rinsing your hands, please don't use standing water. Use running water, so the tap should be running, and then you wash your hands. And when you do that, use disposable towels or disposable cloths to actually wipe your hands. While working in the community or working in the home, there must be disposable towels. So, like what I have here, always use the disposables no matter what. Try not to use your clothes to actually, wipe your hands. So there must be access to tissues or towels that you can use. Don't use towels of service users, or napkins that they've put there. You don't know what is in those cloths. They might just be carrying even any kind of virus anyway, and bacteria. So we don't use that. And I'm sure we are all aware of that. Okay, so that's what you do also when you're doing the hand gel. You have to actually go in between, at the back, on your wrist and your thumb. If you don't have access to water, use the hand, use the alcohol rub like you would use water. Also, the time that you use to form the ladder, you should sing, the happy birthday to you, happy birthday to you, and you sing it twice. If you do that, it would last for like 20 seconds. So 5 seconds is not enough to just do like this and wash your hands. You do need to actually do the full throttle of at least 20 seconds or if more, so that you are guaranteed of actually protecting yourself, okay? And you wash your hands as many times as possible. So there are different times that you'll be expected to actually wash your hands. We have what we call the 5 moments for hand hygiene. Okay, so for care staff, we expect that as you arrive at your place of work, wash your hands. When your hands are soiled, wash your hands. Before and after touching a resident or their belongings, wash your hands. Before and after touching any equipment, before handling food or drink, or handling medication, before leaving the workplace, wash your hands. Before entering or leaving a clinical area, wash your hands as well. And that would be also the case with those of you working in nursing, in the care homes as well. So washing of hands should become second nature. When you get home, wash your hands, okay? Before you do anything, before you touch your loved ones, before you do anything at all. Okay, this might feel like common sense, but it's important that we reiterate it so that we don't relax on the measures. When you come into the office, wash your hands. They will also ask you to use the face mask as well. Please make sure that you observe all these precautions. Okay. All right. Any questions? We will be rounding up shortly. Any questions?
Yes, you have several questions, please.
Okay.
The first question is from Bob, and he says that some service users do not have hand washing or disposable towels. What should we do in that case? Okay. And the second question is from Candida, and she would like to know how often should hand gel be used? And Margaret has also asked the question, is it safe to wear a face mask for more than 10 hours a day without taking it off?
Okay. All right. So you've asked me 3 questions. So I hope I'll be able to take it in the same way. So the first one you asked, please come again.
The service users don't often have disposable towels or hand washing in their homes.
Okay.
Yes, so what should they do in that case?
So in that case, you want to use your hand gel, right? Because you know that if you go washing your hands, then you would not actually have what to wipe it with. That's what you mean, right? So you want to use hand gel. If for any reason you are able to provide yourself with tissues, I always have pocket tissue, some kind of tissue in my bag. And so if I'm working in the community, I would not assume that they would have disposable tissues for me to use. I make sure that I have some in my bag. But if that's the case, that you don't get to wash your hands because there's even no basin, nothing, then that's the reason for the alternative, which is the hand gels. Second question, please. So the second question.
Sorry, how often should hand gel be used?
Okay, so I can't actually say how often it should be used. I'm wondering why that question, but what I can say is you strive as much as possible to do the preferred. Please, sorry if you are talking, please mute yourself. Okay, so you would always strive to use the preferred method of hand hygiene, which is hand washing. So if the case is that you do not have the opportunity to wash your hands, that is when you resort to hand gel. It does not substitute hand washing. So as many times that you might use hand gel, you have to actually intermittently find opportunities to wash your hands. That's what I can say for now. I can't say 50 times, I can't say 2 times, but we've always said it is much more safer to wash your hands with soap and water than to use hand gel. Okay?
Okay, and the last question is from Margaret. Is it safe to wear face masks for more than 10 hours a day without taking it off?
Okay, so when you say safe, are you working straight 10 hours? Because I'm assuming you will take lunch breaks, you might want to eat a snack. So at that point in time, I'm sure you're taking off your mask. So I can't see how you would use mask 10 hours straight. So every time you need to take a break, you need to eat, you need to drink water, it gives you the opportunity to take off your mask. If for any reason you're feeling uncomfortable, you cannot breathe, you're free to take off your mask. Anytime you take off your mask though, that means that you've actually you've come in contact, you've taken your hands to your face and you've actually been in contact with the mask. You need to dispose it and then take a fresh one, especially if you didn't take it off with the normal step-by-step precaution. So I'm going to show you how to actually take off PPE. We'll do donning and doffing PPE right now, just after the questions. But I don't see how you would be wearing a mask for 10 hours straight.
Okay, sorry, I do have.
Okay, any more questions?
Okay, sorry, 1 minute, please. Yes, we do have, some people are not able to enable their video. Is that?
That's okay.
That's okay.
Yeah.
Okay.
All right. Any other questions? I'm free to continue, right?
I'm sorry, one more question just came in.
Okay.
So if the care workers are going from one client to the other, shouldn't they be changing their face masks as they go to the next client?
Okay, so this is what we discussed, that there are new updates to the guidelines from the public health. You can also find it on gov.uk, and we're also going to make all these links available to you. Apparently, it's been sent in your emails as well. The new guidelines is that the face masks, they are there to protect you, first of all, okay? And so if you are working with service users that do not have COVID-19, feel free to use your mask from service user to service user. Even while you're on your journey from, walking to a service user, taking public transport or in your car, feel free to use the one mask. The only time is that if you take it off, and then your hands have come in contact with surfaces, then you're more likely to have contaminated the mask. In that case, you might need to dispose it. Let's say it's damp or it's broken or it's no longer in shape. Then at that point in time, you need to dispose it. However, if you're working with a service user that is confirmed to have COVID-19, maybe they are coughing and they are sneezing, and in that instance, it's different. You shouldn't be taking that mask to the next client because you might just be spreading the virus. Okay, but there are other diseases or symptoms, other things that people might have That doesn't mean that because you're going from service user to service user, you have to be changing mask. No, you don't have to, according to the current guidelines.
Okay, one more question. Should service users be wearing their face mask?
Okay, so service users who have symptoms, yes. However, how do you know? Because you might not actually see any, if they are not visible symptoms, they are not coughing, they're not sneezing, and if they don't want to wear the face mask, you can't force them, they still do have rights. So some service users are already conscious of their own infection control, and they will freely wear the mask if they don't have COVID-19, or if they do. But it's important that you understand that the clients have rights. They can be encouraged to use the face masks, but not forced. Okay.
Okay,
Depending
I think
on the
Janet,
activity you're actually carrying out with the service user. Maybe when you want to give them a bath, you're going to be less than 2 meters with them. You can get them to wear their mask if they are coughing and all that. And when you are not in range, they can be free. Okay.
Okay. Janet, I think she may have signed in after you discuss regarding the hand gel. Now,
yes,
she wants to know if she can get hand gel.
Yes. So it's part of the PPE that we provide in Supreme for our care workers. So please just ask in your branch and they will be able to make that available to you. Okay. All right. So just before we round up, I would like to actually, I know that you're already using your PPE, in the workplace, but just to be sure that everybody is using it correctly, how do you put on your PPE? What do you put on first and how do you take it off as well? The guidelines are actually very clear. We've circulated videos, but I just want to actually be sure we know. So use the chat box. If you're going to put on your PPE, what do you put on first? So please use the chat box to respond. What will you put on first? Is Mark on the call? Abin?
Yes, he is.
Okay, all right. Because I just wanted to know if you could take a screenshot and all that. Okay. All right. Okay, so I'm reading the chat to see your responses, and I can see varying answers. So some of you are saying gloves. Some of you are saying aprons. Some of you are saying mask. So you see, we are all not speaking the same language here because there can only be one item that you will put on first. And some of you have said nothing, which I feel you are not very sure. Okay?
Okay, sorry. Can I say something before we proceed?
Yes, please.
Yes, okay. Now, in terms of everyone enabling their video for the screenshots,
yes, please.
We are not able to do that because
nobody's able to enable.
Yes.
Okay, so I have to do that from you. Check the participant.
We took a screenshot of everyone, all the names.
Of the names.
Okay, I think I know what has happened when we were creating. We had actually shot off video. Let me just see if I'm able to enable from here. Oh dear Lord. Okay, I'll try something when we finish and see whether we can all have the screenshot. But yes, I was saying we have answered the question differently, and there can only be one thing that you will put on first, and that is actually the apron. So a few years ago, it will be the gloves, but the guidelines have changed now. The first thing to put on. So if you can see me, when you get to your service user's home, the first thing you do is your hand hygiene. So if you've not got if you've got access to water and soap, go through your 6 steps, hand hygiene, wash your hands. If not, use your hand gel and actually make sure that you follow the 6 steps as well. So you rub it, okay, go through your fingers, go to the back, do your fingertips and go through your thumbs, and then you do your hand hygiene, okay? Then you take your apron, okay? So you want to open up the apron completely, because if you don't open it completely, you might find out that it's all stuck together at the bottom and you didn't actually cover yourself properly. So you open it to the end and then you put on your apron first. So if you can see me, just say yes, I hope you can. Okay, so maybe I should stand. So you put on your apron first and you tie it and secure it. Okay, so remember your hands are already cleaned, they're already washed, so you're not contaminating your apron in any form. Tie it and secure it and make sure that you're all covered with your apron. What's the next thing after your apron? Then you take your face mask. So take your face mask, and you know the way to use this one. So you use the blue side should be outside, the white side should be inside, and then you've got a firm top at the top, which feels like there is, you know, a bendable pin there, and then you hold on to the sides and you slot it on, okay? So secure it properly. So I'm trying to secure my mask. Okay, so it's secured. And then you see the top bit that is hard. You can now shape around your nose, okay, and shape your face. And then you can now pull down the mask underneath and make sure that you're all secure. Once you do that, the next thing to take, if you're working with someone who is actually COVID-19 confirmed, then you do need your either disposable or reusable. So this is a reusable one I'm using here. Then you put on your visors. Okay, so put on your apron first, your mask, and then your visors. After then you can now take your gloves. Make sure that your gloves is the right size. So always use the size that is appropriate for you. There's no use using just any kind of size. And then you can put on your gloves. Okay, so you're all kitted up now and ready to work. If you're working with clients who need you to use shoe covers, and that should have been put on, okay? All right, so you're all kitted. You finished doing your personal care, you've done your washing up, you're ready to go. What would you take off first? So in this case, I want you to type, what would you take off first once you have finished carrying out your duties in the service user's home or in the service user's room? Feel free to participate on the chat. So I have a mixture here now. I have apron, I have gloves. So, you know, there's still a mixture here. And only one can be the first thing to take off. So today we want to actually tell you what the guideline says. Before, many years ago, you'll be using your gloves and taking off things. Now you take off your gloves first. And how do you take off your gloves? Make sure that your gloves do not come in contact with your actual hands. So you want to pull this out, right? Some people might want to dip their hands, but I still find that a little bit hard to do. So I pull it off and then I pull it off, right? And then I can now dip my finger into the second one and pull it off. Okay, that should go immediately into the bin. Then the next thing you want to take off before you do that is you do your hand gel, hand hygiene. You've just taken off your gloves. You want to make sure that there is no contamination on your hands. So you do your hand gel. And then now it's time to take off your apron. So to take off your apron, just stretch behind. Obviously, you've done your hand hygiene, and then cut it. And once you cut it, let it fall just over like that. Then go to the back and cut it as well, and then close it up, which means that you don't get to touch the outside of the apron. You now fold this without touching the outside of the apron and dispose immediately. After you take off your apron, then you can take off your mask, okay? So to take off your mask, try not to touch anywhere, you know, around the mask. That is the contaminated area. So you have to just, your hands are actually clean. If not, do your hand hygiene again before you touch your face. Do your hand hygiene and then reach for the back of your ears. Take it off one side, take it off the other side. Now, you see, you want to use this again because you are going to another client. You need to fold it out. So you see the way I folded it out? Then I can place it in a plastic bag and put it in my bag. That's how I will keep it to use it again if I don't want to wear the face mask throughout the day. However, if it's been soiled or it's broken, then in that case, it goes in the bin immediately. You can actually leave it on if you're not actually, you know, maybe the next door neighbor is the next client. You can leave it on and go out with it. That is not a problem. You can leave it on and go on the bus. That is not a problem, okay? Take off your visors at this point as well. Follow the normal procedure. If it's a disposable one, dispose. If it's supposed to be reusable, follow the guidelines and the cleaning agents that you're supposed to use, fold it and put it in a plastic bag and then put it in your bag. Okay, so that is how you don and doff your PPE. So if you've been doing it any step, you know, doing any one first, let's all be on the same page today and spread good practice with your colleagues. First thing to put on is actually your apron. Then you do your, you do your mask. If you have to use visors, and then you now do your hand, your gloves final. To start with, when you're taking off, you take off your gloves, then you take off your apron, take off your mask, and then you take off your visors, okay? So that is if you're working with confirmed COVID-19, then you would need eye protection. And it also depends at what stage. Are they coughing? What are you doing for the service user? Okay, just make sure that whatever you need, you have discussed with your manager, so you're not going in without the appropriate kits. Okay, we have kits all put together for you in the offices. Okay, all right, any questions on the donning and doffing? Any questions?
None.
None. Okay, thank you very much. Okay, so just want to see, so we are going to circulate the guidelines again so that you can read them for yourself. There are, questions, when you say frequently asked questions, which will be of interest to you, and they're very, very useful. So go through the guidance when we send it to you. There are quite a number of them, and it would, clarify anything that you might have. I think this is about 30-something questions. Yeah, there are 33 of them. Okay, 33 questions. Like this 33 says, number 33 says, do I need to wear PPE if I'm able to maintain 2 meters social distance? If you are able to maintain a distance of 2 meters away from clients and household members, you do not need to wear PPE unless for other reasons set out in the standard infection prevention, or if anyone in the household is shielding. You see, so it gives you clarity. If you still have questions, when we send the guidelines, please read them and read the frequently asked questions as well. And even if there is a question that is not covered, please feel free to actually call your care coordinator or your manager, and I'm sure they'll be very happy to answer your questions, because sometimes questions could be on a client-by-client basis or on a carer-by-carer basis as well. So this brings me to the end of today's refresher, and I look forward to receiving your answers once we send out a little quiz. We will send out a little quiz. Make sure that you answer them so that we know that everybody actually is on the same page and understand what they're doing. So there's not going to be a fail or pass in this quiz. Once you do it, it's just to be sure that you actually understood what was discussed. With regards to the current test and trace, so we do have test and trace at the moment. I'm sure many of your managers would have informed you about the test and trace. You could go and actually do the antibody testing or the coronavirus test. These are simple procedures to follow. And if for any reason you are experiencing symptoms, then you do need to actually self-isolate. And I'm sure you are aware of the procedures for that, but this is important. We would like to get feedback from your tests that you've carried out. So if you haven't done the test and you need more information, that has been sent out to you, but I will send it out again so you can follow the procedures and go do the coronavirus test, go do the the antibody testing as well, and let us know the feedback as well. Okay, so without further ado, we're going to be rounding up today. Thank you for listening. And if you have any questions, feel free to do so, which will be the last of it. But if there are no questions, any questions, Abin? Okay. All right. So thank you, everyone. I really appreciate your time on the call. And from me.
Sorry, there was one from Bob. Bob.
Okay, please go ahead.
He would like to know when everyone will be getting tested.
Okay, so the information for testing will be made available to you again.
But that will make it very fast.
It's very simple processes. Okay, so depending on what is easier for you, maybe to go through the drive-through, or you want a test kit sent to you at home, we will send you the information that you need to follow so that you can get yourself tested. Is that okay? Okay, so to look out for in your emails, that will be sent out today. So you will receive information about testing, and you would also receive the guidelines that we have looked at today, the updated guidelines. So go through them. And if you still have questions, feel free to actually call your branch, okay? All right. So thank you, everyone.
One more question.
Okay, go ahead.
Sorry. Okay. Sorry, this is from Venetia, and should all be tested when returning to work?
Oh, yes. So if for any reason you've gone off to self-isolate, you also want to have rest of mind that you're actually now clear of the virus. So you should do the testing and test negative to come back to work. I think that will be the normal thing to do. But now we are saying even if you don't have the coronavirus, you should still test because you don't have to be symptomatic to actually know. You might not be sneezing and coughing, but you just want to have rest of mind, go do the test, okay? And you can do the antibody testing as well. All right.